Thank you, Christy. Welcome everyone to the IRF and LTAC Virtual Training Program Part 2. This is Section M, Skin Conditions. As Christy said, my name is Megan Bernier. I am a physical therapist with experience in direct patient care, compliance, clinical documentation, and provider education for IRF, LTAC, and home health providers. And I am a post-acute care clinical manager for Oasis Answers, Inc. I'm joined today by my colleague, Ellen Strunk, who is also a physical therapist who works with Acumen LLC as a clinical lead. She supports Acumen with her clinical experience across the post-acute care settings, and her background also includes functional outcomes and quality measures. During today's presentation, we will summarize the data elements M0210, unhealed pressure ulcers and injuries, and M0300, current number of unhealed pressure ulcers and injuries at each stage, and review some of the coding guidance for Section M. We will also take time to apply knowledge of the coding instructions and other coding principles that was acquired and reviewed during Part 1 of the Section M webinar. And we'll use these coding principles to work through 7 practice scenarios. As discussed in Part 1, the assessment time period at both admission and discharge for Section M is 3 days. So this means for admission, it is the day of admission and the following 2 days, and at discharge, the assessment time period is the day of discharge and the 2 days prior. Let's begin by reviewing the item M0210, unhealed pressure ulcers and injuries. M0210 is a gateway item that identifies if the patient has one or more unhealed pressure ulcers or injuries present. Code 0-No indicates that when the first skin assessment was completed at admission, or when the last skin assessment was completed at discharge, there were no pressure ulcers or injuries identified. And code 1-Yes for M0210 is used to indicate that there was at least one pressure ulcer or injury identified. And this item includes stage 1s, 2s, 3s, and 4s, as well as any unstageable pressure ulcers or injuries. Let's look at our first scenario. A patient was admitted to the facility, and the admission nurse completed the first skin assessment on the day of admission. The nurse noted that the patient currently has a stage 2 pressure ulcer on the left lateral malleolus and documented this in the patient's medical record. How would you code M0210 on admission? Would it be A, code 0-No, the patient did not have a pressure ulcer or injury on the first skin assessment in the 3-day assessment period, or B, code 1-Yes, if the patient had any pressure ulcers or injuries, stage 1, 2, 3, or 4 are unstageable on the first skin assessment in the 3-day assessment period. Take a couple seconds and please lock your answer in for the polls. All right, so why don't we close out the poll? And great, so we can see that 96% of you answered code B1, code 1-Yes, and that is the correct code. So the reason that B, code 1-Yes is the correct answer is because on the day the patient was admitted to the facility, the admission nurse completed that first skin assessment and identified a stage 2 pressure ulcer on the left lateral malleolus. So the assessment was completed within the 3-day assessment period, so M0210 would be based off the presence of that stage 2. Let's take a look at one more scenario for M0210. The patient has been in the facility for 20 days and will be discharged home. 10 days prior to discharge, the documented skin assessment noted that there was a stage 2 pressure ulcer on the patient's left hip that was healing. 2 days prior to discharge, the documented skin assessment stated that the stage 2 pressure ulcer had healed, and there were no other pressure ulcers or injuries present on discharge. How would you code M0210 on discharge for this scenario? Would it be A, code 0-No, the patient did not have a pressure ulcer or injury on the left skin assessment in the 3-day assessment period at discharge, or B, code 1, yes, the patient had a pressure ulcer or injury, either stage 1, 2, 3, 4, or unstageables on the last skin assessment in the 3-day assessment period at discharge. Take a few seconds and enter your response into the polling app. All right, and let's see how everyone did on this question. So 83% of you answered A, code 0, no, and that is correct. Good job on that, everyone. In the scenario, the last skin assessment was completed 2 days prior to discharge, which was within the 3-day assessment period. This discharge skin assessment revealed that the stage 2 pressure ulcer on the patient's right hip had healed, so there were no pressure ulcers or injuries present at the time of the last skin assessment. And it's important to remember that healed pressure ulcers are not reported on the IRF-PAI or LCDS. Let's now turn our attention to M0300, current number of unhealed pressure ulcers and injuries at each stage. At admission, for both the IRF-PAI and the LCDS, we are reporting the number of pressure ulcers or injuries that are present at each stage. On the discharge assessment, we're reporting 2 things. First, the number of pressure ulcers and injuries present at the time of the last skin assessment. And second, for each of those pressure ulcers or injuries identified as being present, if they would also be considered as present on admission. As discussed in the earlier slides at the beginning of today's webinar, just like with M0210, M0300 should be completed as close to the time of admission as possible and as close to the discharge as possible. Before practicing some coding scenarios, let's review what it means when we say that a pressure ulcer injury was present on admission. So the guidance and definitions as found in the guidance manuals state that in order to determine if a pressure ulcer was present on admission, that if for each pressure ulcer or injury present at discharge, we need to consider current and historical levels of tissue involvement in order to determine if it was present at the time of admission. If the location and stage of a pressure ulcer present at discharge was also reported at that same stage on the admission assessment, then it would be considered present on admission and not acquired while the patient was in the care of the IRF or the LTAC. Keeping this in mind, let's take a look at the first scenario for M0300. A patient was admitted to the facility. During the initial skin assessment on admission, the assessing nurse found a stage 2 pressure ulcer on the right elbow and a stage 2 pressure ulcer on the left hip. Due to a progressively degenerative condition, the patient has poor mobility. During the 3-day admission assessment period, the patient was observed to be resistant to changing positions and at times refused to transfer out of the wheelchair. Early interventions were instituted for pressure reduction when sitting in the wheelchair. 7 days after admission, the patient was assessed to have developed a stage 1 pressure injury on his coccyx despite these early interventions. Throughout the stay, the patient continued to be resistant to changing positions or getting out of the wheelchair. In addition, the patient refused to use any pressure relief cushions despite being offered various options. 1 day before discharge, the assessing nurse completed the last skin assessment and documented the following. The stage 2 pressure ulcer on the right elbow has healed. The stage 2 pressure ulcer on the left hip healed, but then reopened to a stage 2, and the coccyx ulcer has progressed to a stage 2. The patient will be receiving home health services for continued wound care on discharge. How would you code M0300 at admission for this scenario? Would it be A, M0300A1 stage 1 would be coded as 1, and M0300B1 stage 2 would be coded as 2. B, M0300A1 stage 1 would be coded as a 1, and M0300B1 stage 2 would be coded as a 0. C, M0300A1 stage 1 would be coded as 0, and M0300B1 stage 2 would be coded as 1, or D, M0300A1 stage 1 would be coded as 0, and M0300B1 stage 2 would be coded as 2. All right, let's see how everyone did. So it looks like the majority of you picked D, and that would be the correct response. So D, M0300A1 stage 1 would be coded as 0, and M0300B1 stage 2 would be coded as 2. So good job, everyone. Let's review the rationale to see why D is correct. So during the initial skin assessment on admission, a stage 2 pressure ulcer on the right elbow and a stage 2 pressure ulcer on the left hip were documented. Therefore, M0300B1 stage 2s would be coded as 2. The development of the stage 1 pressure injury on the patient's coccyx was not identified as part of the first skin assessment that was conducted on admission. Rather, it was identified 7 days later. Therefore, it would not be coded on the admission assessment. So M0300A1 would be coded as 0. Keeping the same scenario in mind, how would you code M0300 on discharge? Would it be A, M0300B1 stage 2 would be coded as 3, and M0300B2 stage 2s present on admission would be coded as 2. B, M0300B1 stage 2s would be coded as 2, and M0300B2 stage 2s present on admission would be coded as 2. C, M0300B1 stage 2 would be coded as 2, and M0300B2 stage 2s present on admission would be coded as 1. Or D, M0300B1 stage 2 would be coded as 1, and M0300B2 stage 2s present on admission would be coded as 1. Please lock your answer in the app now. All right, why don't we close out the poll? And it looks like 60% of you answered it as C, M0300B1 stage 2 would be coded as 2, and M0300B2 stage 2 present on admission would be coded as 1, and that is the correct response. So let's look at the rationale for that. So in the scenario, the discharge assessment documented that the stage 2 pressure ulcer on the right elbow that was present on admission had healed. So this is not recorded on the discharge assessment. The stage 2 pressure ulcer on the left hip that was present on admission healed, but then reopened to a stage 2. So this ulcer would be reported at its worst stage, which is the stage 2, and it would be considered as present on admission because on discharge, it was not presenting at a higher numerical stage, nor did it become unstageable. The stage 1 pressure injury on the coccyx that was identified 7 days after admission has progressed to a stage 2 pressure ulcer. And since this pressure ulcer was not identified on admission, but it was a discharge, it is documented as not present on admission. This rationale aligns with the guidance that states if a patient has a pressure ulcer that was documented on admission and at discharge is documented at the same stage, it would be considered present on admission, even if during the stay, the original pressure ulcer healed and then reopened to the same stage. Also, we want to remember that a previously closed pressure ulcer that opens again should be reported at its worst stage unless currently presenting at a higher stage or unstageable. I will now pass the presentation over to Ellen Strunk to review the remaining coding scenarios.
Thanks, Megan. Let's look at our next scenario, which is scenario 4. A patient develops a stage 2 pressure ulcer on the sacrum while at the IRF or LTAC. Due to cardiac complications, however, the patient is discharged and admitted to an acute care hospital for the treatment of an acute myocardial infarction. The patient then returns to the IRF or LTAC more than 3 days later for continued care. And the patient now has a stage 3 pressure ulcer on the sacrum in the same location. On the day of discharge from the IRF or LTAC to home, the nurse conducts the last skin assessment and documents that the pressure ulcer on the sacrum is healing, but remains as stage 3 pressure ulcer. So how would you code MO300 on the first discharge? Would it be A, MO300B1 stage 2 is coded as a 1, and MO300B2 stage 2 present on admission is coded as 0. B, MO300B1 stage 2 is coded as a 1, and MO300B2 stage 2 present on admission would be coded as 1. Or C, MO300B1 stage 2 would be coded as a 0, and MO300B2 stage 2 present on admission would be coded as 0. Please enter what you think is the right response in your app. All right, let's see how everybody did. Hopefully you selected response A. That is the correct one. It should be MO300B1 stage 1 would be coded as a 1, and MO300B2 stage 2 present on admission would be coded as 0, since this is the correct response. So let's go ahead and look at our rationale. Okay, the reason why response A is correct is because while at the IRF or LTAC, the patient developed the stage 2 pressure ulcer, which is documented on the patient's first discharge. And this pressure ulcer is not considered present on admission because it developed while the patient was in the IRF or LTAC and is considered facility acquired. Now, keeping the same scenario in mind, how would you code MO300 when the patient is readmitted to the IRF or LTAC? MO300B1 stage 2 would be coded as a 1. MO300C1 stage 3 would be coded as 0. MO300B1 stage 2 would be coded as 0, or MO300C1 stage 3 would be coded as a 1. Or C, MO300B1 stage 2 is coded as 1, and MO300B2 stage 3 would be coded as a 1. So take a moment and select the best answer. All right, let's see what everyone came up with. The majority of the people, about 82% of you, chose B, and B is the correct response. MO300B1 stage 2 would be coded as a 0, and MO300C1 stage 3 would be coded as a 1. So let's look at why. When the patient returned to the IRF or LTAC for the second stay, a skin assessment was completed on admission, and the nurse documented that there was now a stage 3 pressure ulcer on the sacrum in the same location as the previous stage 2 pressure ulcer. So with that information, then MO300C1 would be coded with a 1. Remember that when a patient is discharged to another facility or hospital for longer than 3 calendar days and then subsequently returns, and a current pressure ulcer increases in numerical stage or becomes unstageable due to slough or eschar, then it is coded at the higher stage or unstageable status on the patient's admission assessment for the second IRF LTAC stay. Now, finally, for this scenario, how would you code MO300 for the second discharge assessment? Would it be A, MO300C1 stage 3 is coded as 1, and MO300C2 stage 3 present on admission is coded as a 1? Or B, MO300C1 stage 3 is coded as 1, and MO300C2 stage 3 present on admission is coded as 0. Or C, MO300C1 stage 3 coded as a 0, and MO300C2 stage 3 present on admission is coded as 0. So take a few moments and lock in your answer. All right, let's see how everybody did. About 93% of you coded A, and that is the correct response. MO300 C1 stage 3 is coded as a 1, and MO300C2 stage 3 present on admission is also coded as 1. And that's because on the day of discharge to home, the nurse conducted the last skin assessment and documented that the patient has a healing stage 3 pressure ulcer on the sacrum. This pressure ulcer then is considered as present on admission because while it increased in numerical stage between the first discharge and subsequent admission back to the IRF or LTAC, it did not increase in numerical size or become unstageable prior to the second discharge from the facility. Let's take a look then at scenario 5. The patient is being readied by the discharge nurse for discharge tomorrow and is going to be followed by home health services. The discharge nurse reviewed the first skin assessment completed on the day of admission to the facility, which documented a stage 2 pressure ulcer on the right hip and a non-removable immobilizer on the patient's right leg. There was no documentation sent from the hospital with the patient indicating that there was a known stage 2 pressure ulcer on the right medial malleolus covered by the non-removable immobilizer and a stage 2 pressure ulcer on the right hip. So, given that information, how would you code MO300 on admission for this scenario? Would it be MO300B1, stage 2 is coded as a 1, and MO300E1, unstageable non-removable dressing device would be coded as a 1, or B, MO300C1, stage 3 is coded as a 1, and MO300E1, unstageable due to a non-removable dressing or device, is coded as a 1. Would it be MO300B1, stage 2 is coded as 1, and MO300C1, stage 3 is coded as a 1, or D, MO300B1, stage 2 coded as a 1, and the ulcer under the immobilizer is not coded because it could not be assessed on admission. So please enter your answer into the polling app. All right, let's see how everybody scored this item. Hopefully you all picked A. Excuse me. 58% of you did select A. It is the correct response. MO300B1, stage 2, would be coded as a 1, and MO300E1, unstageable due to non-removable dressing or device, would be coded as 1. And the rationale for that is that when the first skin assessment was completed, it was documented that there was a stage 2 pressure ulcer on the right hip and a known stage 2 pressure ulcer on the right medial malleolus underneath the non-removable immobilizer. So even though there is documentation that the known pressure ulcer underneath the non-removable immobilizer is a stage 2, then when a pressure ulcer is known but not covered by a non-removable dressing or device, it should be coded as unstageable due to the non-removable dressing or device. All right, let's move on to our 6th scenario. The patient was admitted to the IRF-LTAC with a blood-filled blister on the right heel. And after further assessment of the surrounding tissues, the nurse documents on the first skin assessment that the heel blister is a deep tissue injury. 4 days after admission, the right heel blister is drained and it conservatively debrided at the bedside. After debridement, the right heel is staged as a stage 3 pressure ulcer. The nurse completes the last skin assessment the day before discharge and documents that the right heel remains stage 3. So how would you code MO300 on admission? Would it be A, MO300B1, stage 2 is coded as 1, MO300G1, unstageable due to DTI, is coded as 1, MO300C1, stage 3 is coded as a 1, or MO300 is completed with dashes because the anatomical tissues within the wound could not be assessed. So take a few minutes, few seconds rather, and complete the answer. Looks like those answers are rolling in. All right. Go ahead and close the poll now. And the majority of you got the correct answer for this scenario, which is MO300 G1 unstageable DTI would be coded as a 1. And in the scenario, a DTI would be coded because, per the scenario that we read, after a thorough clinical and skin examination, the assessment of the right heel and surrounding tissues revealed a skin injury consistent with what constitutes a DTI. Remember that coding of MO300 is based on the first complete skin assessment that occurs within the 3-day assessment period. Now, for this scenario, let's code MO300. And this time we're at discharge. Based on the information provided, how should MO300 be coded on the discharge assessment? MO300C1, stage 3, would be coded as a 1, and MO300C2, stage 3, present on admission, is coded as 0. Or B, MO300C1, stage 3, is coded as a 0, and MO300C2, stage 3, present on admission, is coded as 0. MO300C1, stage 3, would be coded as a 1, and MO300C2, stage 3, present on admission, would be coded as a 1. Or finally, D, MO300 G1 DTI would be coded as a 1, and MO300 G2 DTI would be coded as 1. So take a few seconds and lock in your answer. Got almost half of you voted. All right, go ahead and close this one down. And the majority of you got the correct answer, which is C, stage 3. MO300C1, stage 3 would be coded as a 1, and MO300C2, stage 3, present on admission, would be coded as a 1. Remember that once a DTI is fully opened, exposing the level of tissue damage, the wound should be reassessed and staged via observation and/or palpation based on the clinical assessment and staging criteria. So in the scenario, when the DTI heel blister was drained, the tissue was debrided and it was subsequently numerically staged as a stage 3. And because that was the first time the ulcer was able to be assessed and numerically staged, and it remained at that stage at the time of discharge, it is considered to have been present on admission. Therefore, MO300 is coded as a 1, and MO300C2 is coded as a 1. Let's take a look at one more scenario. Our patient is admitted to the IRF and LTAC, and the admitting nurse conducts the first skin assessment. Upon completion of the assessment, the nurse documents that a DTI with intact skin was identified on the patient's right hip. At the skin assessment completed 2 days before discharge, the assessing nurse documents that the previous DTI has become unstageable due to slough obscuring the entire wound bed. The DTI never evolved to be numerically staged while the patient was at the facility. So the first question is, how would you stage or how would you code MO300 on admission? Would it be MO300F1, unstageable due to slough or eschar, coded as a 1? Would it be MO300G1, unstageable due to DTI, would be coded as a 0? MO300G1, unstageable due to DTI, coded as a 1? Or MO300 is completed with dashes because the anatomical tissues within the wound cannot be assessed. So take a few seconds and select the best answer for this question. All right, the majority of you, 87%, got the correct answer, which is MO300 G1 unstageable as a DTI would be coded as 1. So option C. And the reason for that is that after the nurse examined the patient's skin, there was an identification of an intact area of skin injury consistent with what constitutes a DTI. And it was present at the right hip and surrounding tissues. So for the admission assessment, MO300G1 would be coded as a 1 because the DTI was observed at the time of the first complete skin assessment. Let's code the discharge assessment. So when the patient was discharged, how would you code MO300 for the same scenario? MO300 F1 as unstageable due to slough and/or eschar is coded as a 1, and MO300 F2 unstageable due to slough and/or eschar present on admission coded as 1. Or B, MO300 F1 unstageable due to slough or eschar is coded as a 0, and MO300 F2 unstageable due to slough and/or eschar but present on admission would be coded as 0. Or C, MO300 G1 unstageable due to DTI is coded as a 1, and MO300 G2 unstageable due to DTI present on admission coded as 0. So take your time and respond to this one. All right, so let's go ahead and close it up. And for this one, A is the correct response. You would code MO300 F1 unstageable due to slough and/or eschar, coded 1, and MO300 F2 unstageable due to slough and/or eschar present on admission would be coded as a 1. And in order to accurately code this scenario at discharge, remember that if a DTI was observed on admission and does not evolve to be numerically staged, but is subsequently classified as another type of unstageable pressure ulcer injury, it would be considered and coded as present on admission on the discharge assessment in that unstageable pressure ulcer injury category. So in this scenario, 2 days before discharge, when the nurse completed the skin assessment, they documented that the previous DTI has become unstageable due to slough obscuring the wound bed. Because the DTI that was observed on admission did not evolve to be numerically staged, but became unstageable due to slough, it is considered then to have been present on admission. Therefore, MO300 F1 is coded as a 1, and MO300 F2 is coded as a 1 on discharge. So this concludes the Section M Skin Conditions Workshop. Hopefully, during the presentation today, you have learned to complete the Section M items as close to the admission and discharge as possible, following the instructions in the guidance manual. And also remember that in order to code your patient's condition correctly, the etiology of the wound must first be determined. And lastly, in order to properly stage a pressure ulcer, you must be able to visualize the tissues involved.